How are you?
I'm doing good.
Good. Thank you for waiting so patiently for me. I'm not Kedra. You know I'm here to see you today. So I brought you a little bit of literature handout. This is about diabetes. We typically check your blood sugar when you come in. I know it's right here before lunchtime, and so sometimes people's blood sugar is high, sometimes it's low. Ideally, we want to get your blood sugar checked before you eat. So we know that you get ready to head out for lunch, so we want to go ahead and check your blood sugar. Okay. We'll go over some of the details of this pamphlet in just a few minutes, but let's head here. So I have this set up, or actually Janet set it up for us. We're going to put on some gloves because anytime we are dealing with blood or body fluids, we want to get our gloves on. People who are familiar, this is a AccuCheck or blood sugar machine. Typically inside of that you have some strips. You actually have a meter. I can get it out here. You have a meter, and then these are some QCs that you can do just to make sure your machine is working properly. One thing I want to make sure that you look at is the date of your strips, because your strips actually do expire. So these strips expire per the manufacturer 8/31/2020. However, they've already been opened and they're only good for 3 months after you open them. So somebody has put the date of October the 8th, 2019 as the expiration date. That is very, very important that you put the date that you open the strips and of course the date that they expire, because you don't want to use expired strips, otherwise it's not going to be of much value. And so we're going to take a strip out here, put it in the machine. Most of the time that turns the machine on. So you see that it's asking for a strip of blood here, or a drop of blood. Diana's going to give me one of her fingers. This is the alcohol pad. So when we're looking for fingers, if you check your blood sugar a lot, you might alternate fingers. If you're somebody who checks a couple times a week, Diana, we're just monitoring her blood sugar, so she is not diabetic, but we are talking with her just about diabetes because we know it runs in her family, and we want to monitor her and make sure that she's not on that road to diabetes. So we're going to use a finger. These two fingers, as you imagine, are used quite frequently. I actually like this finger, the ring finger, because it's not the one that people use a whole lot. And men tend to have very tough skin, and so you want to make sure that in a man you choose a finger that doesn't have a lot of rough skin. She's got well manicured fingers, and so this shouldn't be a problem at all. So we're going to clean with alcohol here. I typically will push a little bit so that we can get some blood out on the end there as we wait. And then you want to actually do your stick on the side of the finger, which is best, again, because the bed of the finger is going to be most used. You all right, Diana? All right. So we're going to go here and press. So it's a little drop there. You still okay? All right, you should take the first drop and wipe away, and then produce another drop. Here we can get our blood sugar machine, and it beeps when it's ready. So it is beeping to say that it's captured the blood, and it has already, that is very, very quick. It's already processed what her blood sugar is. So the blood sugar is what? It is 95. So somebody in the comments, let me know, 95. Where is that in relation to a good or a bad blood sugar? She's not eaten since breakfast, and so she is before lunch. So do you think 95 is a good place for her to be for her blood sugar? Or do you think it's too high, too low? What should it actually be? Let me see that in the comments. While you're writing that, I'm going to have a little dialogue here with Diana, because we're going to talk about symptoms of high blood sugar and low blood sugar. So you all can hang around to hear some of those symptoms. Remember, I brought her some literature in. It's important that you have things that you can take home to read. If you don't read or don't read well, people who are in your home or that you are around, they're able to read this to you and for you. And so I always like to make sure that patients get some literature to go over what we talk about in the clinic. So how can we tell if your blood sugar is low? What are some symptoms or some things that tells us we can look at to check for a low blood sugar, Diana?
Shakiness, nausea, lightheadedness, blurred vision, feeling nervous or anxious, fast heartbeat, or feeling sleepy.
Right, so people tend to feel anxious, they're nervous, they have a fast heartbeat, they're sleepy. What about the opposite, high blood sugar? How do people tend to feel if they have a high blood sugar?
Urinating more often, being thirsty, blurred vision, feeling tired, and headaches.
So they go to the bathroom a lot, they have some blurred vision, they have headaches, and so that's a sign that the blood sugar is high. And so 95, where do you think that is? Is that high? Is that low? Is that in between? What are your thoughts, Diana?
I think it's normal.
You think it's normal? Let's see if this tells us. So, I like to have a blood sugar of less than 126 before you eat. It's in here somewhere. Here it is. So, before a meal, between 80 and 130, and 1 to 2 hours after the beginning of the meal, less than 180. So, we are before our meal. So you can see again, this is what she gets to take with her just to show where she is in regard to her blood sugar. So she is perfect. She is right in the range that she needs to be. So she is going to keep up the good work with monitoring her diet, with getting some exercise in. And speaking of diet, it's lunchtime, and I know she wants to go to lunch. So I'm going to get off here with you. Hopefully you enjoyed this. Make sure you share this to somebody who may be checking their blood sugar at home so they can make sure that they are adequately checking their sugar. Before I sign off, I just want to say one other thing. This is considered a sharp. So it was a needle that actually stuck into her finger. So where do we put these? I put my gloves in the trash, but surely I don't put this in the trash, do I? No. So we happen to be in the office and we have a sharps container right behind us. You can order sharps containers from your local pharmacy, or there are some places where you can order containers, or you can get a plastic jug. That's better than nothing. You can get a plastic jug and put your sharps in. You do need to let your the people who process your trash know, because there's a special way that they need to discard or know that those are sharps. So if you get an actual sharps container, it will show you how to discard it. But that's very, very important, because you never want to put needles or anything sharp in your regular trash. So if you have any questions, make sure you put those in the comments below. And thanks for joining. Have a great day. Bye.